Systematic racism has been an ongoing issue within the United States for hundreds of years. Many Black individuals have experienced racism and discrimination while seeking health care, which has led to a fear of medical institutions. The accessibility to health care for Black professionals is negatively impacted by institutionalized racism, inequality, and physician stigma and distrust. Generations of Black individuals have shied away from care, been denied care, and may still have to overcome hurdles to see a physician. One contributing factor to a lack of health care is affordability. In Black communities, many do not have jobs that offer them health care or cannot afford the cost of health insurance or prescription drugs. Things that are being done to offset the disparities are investments in anti-poverty programs, implementation of the Affordable Care Act, and better education for public, and then training and informative sessions for physicians. This allows for physicians to be well equipped to support their patients, and while examining this topic, I ran into various roadblocks. I found it difficult to partner with a nonprofit organization within my community due to COVID-19 virus, which is impacting my community heavily. Due to nonprofit organizations assisting in contact tracing and COVID-19 testings, many are not open to assisting in any other projects. Due to this reason, I had to look for other ways to hear about public opinions and concerns regarding the systematic racism impacting Black individuals and their health care. The problem. Black individuals are more likely to have chronic conditions such as obesity, diabetes, which limit their life expectancy. Black individuals are also more likely to have a shorter life expectancy and greater infant mortalities. It is thought that these issues stem from systematic racism, inequalities, and a negative stigma and fear of physicians. Black individuals are less likely to seek medical care and have the means to afford it. When looking for an organization to partner with, I came across a wonderful organization called the Rafiki Coalition. This organization's mission statement aligned very closely with my project, and it was focused on improving the lives of others by reducing the healthcare inequalities for Black individuals within the San Francisco Bay Area. This organization has a large part in helping individuals get tested for COVID-19 virus by directing them to clinics and testing locations in their neighborhood. In addition, Rafiki also participated in contact tracing. Contact tracing can be very time-consuming and challenging. Rafiki is one of the many nonprofit organizations in the Bay Area that is taking charge and making an impact during these uncertain times of COVID-19. Due to these organizations reaching out in the community and adjusting their approach to their current community outreach, I was unable to work directly with Rafiki. This has become my biggest challenge with my outreach project. This was extremely disappointing, especially with the frequent news and articles about the mistreatment of Black individuals in hospitals and the high number of COVID-related deaths in the Black population. Stories such as these illustrate how large the issue is and how it is still very present in our community today. Analysis. Many nonprofit or community-based organizations utilize community engagement in their day-to-day operations. Many organizations focus their efforts on creating new ways to communicate and educate their communities and target populations. By doing so, they are able to build lasting relations with the community members and better understand their needs and any public concerns. Community outreach can look like interactions within a specific neighborhood or civic institution. This work within the community can help create the connection between the community members and allow community members to see the various resources and assistance available to them. These interactions can also encourage the community members to get more involved within their communities. It can be easy to turn a blind eye and feel like one does not have a say or an impact in their community. By interacting with members of the community, providing them with resources and education and encouragement, they can become well equipped to also participate in addressing issues and bettering their environment. The 5 main elements of engagement are informed, consult, involve, collaborate, and empower. With this in mind, one can make a large impact in others' lives. By using this as a form of a blueprint, one can be more proactive and work on ways to interact with their community in a safe manner. This may look like phone trees, social media, YouTube groups, and food and school supply drives. These examples are great to do during COVID-19 pandemic, as they will be contactless and they can keep the community members safe. Recommendations. COVID-19 has made it difficult to interact with efficiently within the community. This has led me to change how I will be conducting my research. Due to the COVID-19 concerns, I will not be able to work closely with an organization within my community. One way that I will be able to better understand the needs and concerns of the community is to utilize the software and website of Pulsar. Pulsar will allow me to look and see what the public opinion is on various topics across social media platforms. By examining what is being said about these various topics, I will have a better understanding of what people are concerned with. Social media has turned into a great way for people to voice their frustrations and concerns and also start movements. This can help me see the main concerns plaguing society today during this pandemic. Through this, we can better plan for community outreach and education. By utilizing Pulsar, we will be able to create new ways to educate and inform community members of various issues and resources that are available to them. Conclusion. With the COVID-19 pandemic, community outreach has been even more difficult. This has caused many nonprofit organizations to think outside of the box and get more creative when looking for ways to interact with their community in a positive way. Although that there are more challenges and obstacles, there are also many ways we can still interact safely with the community. Community outreach and engagement are very important and vulnerable aspects of public work. It can give you the necessary information to better community and improve on issues that are affecting community members. When evaluating new ways to serve the community, one needs to examine the various safe and contactless ways to interact with the community members. By ensuring everyone's safety, one can also improve community relations and serve the community in a safe and efficient way. Although COVID-19 has caused many organizations to evaluate the current practices and brainstorm new ways to safely interact with others, it does not mean that their efforts will go unnoticed. Reflection. Community engagement is a very important aspect of working within the public sector. It can allow one the opportunity to better understand the community needs and to have a good sense of the challenges facing community members. Working in healthcare, community engagement can be very beneficial and lead to progress in various ways. America's healthcare system is very complex and constantly evolves. These small changes can be very impactful in an individual's life. There are also many things that can be improved in our current healthcare system, such as various inequalities and systemic racism and discrimination. These issues can often be overlooked, and for that reason, it is very important to take part in community outreach and engagement to better understand the impacts on our communities and our society as a whole. Although outreach can be difficult or daunting, it can be a great way to find shortcomings and areas of improvement.